Order, order. Can I welcome you all here this morning? This is our second oral evidence session looking at the claimant experience of the work programme. So can I say thank you very much for coming along. But before we get into the questions, can I ask you to very briefly introduce yourselves and the organisation you're from? And if we can begin with you.
Good morning, my name is Rob. I'm Robert Trotter. I'm from Scope, a disability charity.
My name is Duncan Shrubsole. I'm from Crisis, the homelessness charity.
My name is Laura Dewar. I'm from the Single Parent Action Network, a Bristol-based charity that has a national reach.
I'm Sophie Corlett. I'm from Mind, which is a mental health charity.
I'm Paul Anders. I'm from Drugscope, which is a membership organisation for the drug and alcohol sector.
Okay, well, thank you very much for coming along this morning. And what we are keen to hear about is the experience of the clients or your members or the people that you support when they're engaged in the work programme. Can I just begin with a more general question about the relationship between Job Centre Plus and the work programme providers? Because the initial report of the work programme evaluation concluded that despite an aspiration to deliver warm handovers from Job Centre Plus to the work programme, participants were often initially had a poor understanding of what the programme was about, why they had been referred to and what was expected of them. Is that your experience? And if it is, how prevalent is it a problem and what could you do about it? Who wants to start?
I can start.
Sophie.
Yes, I think is the short answer. People find that they're not really sure what's going on when they're in the system, and their experience of it is that it's quite a harassing sort of bullying type of system. So they've gone through the WCA, which for many people with mental health problems is extremely stressful and feels very adversarial. They come to Job Centre Plus, they end up on a work programme, they're not really quite sure what's expected. The first conversation when they appear in the work programme with the provider is around sanctions, and I think people do find it very disorienting. They're not quite sure what's expected. The public expectation is that this is something that's going to help you find work, but that's not how it feels at any point. So yes, I think it is very disorienting, and it doesn't really set people up in a way that makes them best placed to then be positive about looking for work.
Yeah.
From the perspective of homeless people, both working with them directly and research that we've done with other charities, this issue about Job Centre Plus is central to what's happening around the work programme, because people are not, their needs are not being adequately assessed either at Job Centre Plus or when they first go over to the work programme provider, and information that's happening at one is not being passed on to the other. And for homeless people it's particularly important because they are like ex-offenders and some other groups. They are potentially an early entrant group, that if they are identified as homeless, then they can get more support in the work programme. So instead of around £4,000 a head, it could be £7,000 a head. So that completely changes what the work programme conversation could be and what the offer will be. So homeless people, even we've had examples of homeless people who are actually sleeping rough on the streets, has not been picked up in their assessment. They don't have anywhere secure to stay. And they're being passed to a work programme provider who doesn't also understand that, and they're then getting a much more standardised offer when they were supposed to be, the whole aim of the work programme was to get a more personalised offer. And this issue about identification of people being homeless is an issue for the work programme, and also more broadly. We've done a lot of work with Job Centre Plus, particularly some where we've got some services in City and East to try and get them to in London to understand better who is homeless, what the hostels are in their area, what the services are, to try and identify homeless people for the work programme and other services. But there's a real lack of training and skills on the ground and direction from the top that Job Centre Plus should make this a priority. And at later stages in the process, this lack of communication is also coming into sanctioning as well, where poor information flows between the work programme and Job Centre Plus is meaning that people are being inappropriately sanctioned, often at the very first stage.
We've got some questions on that later, I think. Sheila.
My office was told on reasonably good authority, although I don't believe everything we get told, that one of our local job centres was only giving every person with an employment advisor a 4-minute slot. That's to come in and talk about what they've done and where they may be going. I mean, do you think, you may not know the answer to this, and maybe we'll ask Job Centre in due course, but I mean, is it your experience that people get enough time initially, perhaps with JCP, for these sorts of things to be done?
I can't comment specifically on the 4-minute thing, but no, I don't think there is enough time being spent to assess needs. But actually, that's a problem that's happening throughout the chain. And research we did with St Mungo's and Homeless Link as well, 58% of people said that they weren't getting their needs adequately assessed by their work programme provider either. So this assessment of need is crucial, and it's not happening at the start of the process, whether by JCP or by the work programme provider.
But Stephen and Aidan has obviously started.
A very specific aspiration of the work programme is for JCP to do what the chair called a warm handover with work programme providers. That's a very, very specific aspiration for the very reasons you're saying. In all your experience, very, very briefly, are you telling me that within your client group that is simply tending not to happen from JCP to the work programme?
Sorry, Paul first, and then Laura, I'll bring you in.
Okay, thank you.
Thank you. I think broadly speaking, from my experience and the experience of my colleagues, it's not happening. If I can just expand a little bit to put forward some reasons why I believe that may not be happening. I think there are certainly concerns around caseloads. So it's about how practicable it is to do that warm handover. I mean, I'm not sure what the caseload is at Job Centre Plus, but certainly from the work program provider angle, caseloads of 200 to 1 aren't that unusual, I think, which actually, so that there's a capacity issue in providing those warm handovers. And just to say a little bit more about that, I suppose where people with histories of drug use in particular are different is that there has been some work to try to encourage closer joint working between drug treatment providers, Job Centre Plus and work programme providers. That's come from work done jointly by the NTA and DWP. So I think it's a problem that's been acknowledged, but certainly looking at the original protocol that's been in place for some years and the new one that came out towards the end of last year, we're starting to see a little bit of movement, a little bit more communication happening, but I wouldn't want to sound overly positive about that because it's very early days. I think it's something we'll be paying close attention to, but the early signs are mildly encouraging. Right. If I could also just say a little bit about disclosure, because that was something that Duncan touched on. I think, again, notwithstanding the NTA protocol, this is something that we're seeing as a very major problem within the drug sector, and I would echo much of what Duncan said. I think there's an issue of the skills and ability of and the time available to Job Centre Plus advisors to have that kind of conversation which enables somebody to disclose. I think there's a second issue relating to the disincentives to disclose. So I would acknowledge the positive messages being sent out by Job Centre Plus about people being able to disclose and receiving a more tailored approach. I think people's experience has often shown that isn't the case. I think that makes people reluctant to disclose, and particularly for drug users, that raises issues that they may actually be disclosing something that relates to criminal activity. They may also be disclosing something that will be of concern to people who've got parents or caring responsibilities about social service interventions and so on. So I think we need to recognise that people are probably balancing the encouragement that's coming out from Job Centre Plus and the Department for Work and Pensions against the very strong disincentives that militate against that.
Okay, thank you, Laura. Paul, just very briefly, Laura, before it goes on to Adrian, on your experience from your group, is there that warm handover or not?
I based my evidence to the committee on, although I've got a sort of wider context of work that I do with single parents, but on a study that I did towards the end of last year where I interviewed 16 single parents. And over half of them talked about the problem of the lack of coordination between Job Centre Plus and the work programme. I only had one example of someone who particularly thought it was very positive that before they transferred over, they saw a lone parent advisor at the job centre who updated their job-seeking agreement before transfer and saw that as very positive. As a group, I think single parents are different in that, as well as obviously being a job seeker, people have responsibility for a child, and there are inbuilt what are called lone parent flexibilities, which actually, although they're called lone parent flexibilities, they are actually about the well-being of children and the protection of children. So, for instance, it should be around, you know, the hours that someone can work, being able to turn down a job if there isn't suitable childcare. So actually, the coordination between Job Centre Plus and having good action plans and those being translated over to the work programme is incredibly important. I've got examples of the work programme not taking account of those flexibilities, and I think there is an issue about children's well-being because of that.
Aidan was going to come in. Don't worry, Robert, you will get a chance.
Just want to follow up Paul's useful point about disclosure to Duncan. You can understand the reasons why drug users might be reluctant to disclose that sort of information, but I almost kind of beggars belief that it wouldn't be picked up unless someone was homeless. And I'm just wondering if you could give the committee a bit more information. Presumably that is a question that is asked at the initial stage. There are address boxes and so on the forms. Why do you think it's not being picked up so basic so basic an issue?
You would think so. I mean, one of the things is on the address box, people will put down it's a hostel, and Job Centre Plus don't recognise actually that is a hostel. So, you know, I can say we've done some training with job centres, and they thought there were sort of 2 hostels in their patch, and we told them there were 20, and they didn't know that. And that's, again, it goes beyond the work programme. It's actually about Job Centre Plus understanding their locality and where people are in, and that, you know, that can include mental health projects, it can include homeless hostels, include a range of things which are an indicator. There aren't standard questions which say, are you homeless? And the issue why it's important, I said before, is it because you can have access to the early entrant group. It's also about understanding unstable accommodation or high expensive accommodation, because it's high rents, because it's unsupported accommodation, are key factors shaping your ability to move into work. Never mind other issues that you might have that might be tackling, maybe mental health or substance misuse or whatever associated with your experience of being homeless. And again, there aren't, you know, many people who are homeless don't want to go around shouting about it, because if this is a conversation about going back to work, they know their experience of approaching an employer saying they're in a hostel or they're in unstable housing or they're getting by on someone's floor or they're actually sleeping rough is not going to get them a job either. So that's why the whole purpose of the work programme was supposed to be personalised, tailored conversations by skilled people who would tease out some of the barriers that you've got, put in place the right support to help you tackle them and put you on a positive back to work journey. It's more than, you know, that's what's needed, but even some of the basics like the right forms and asking the right questions aren't happening either.
Got more questions about the minutiae of how the work programme works and the interviews coming up later, but can I just ask very simply, is it as simple as a large number of people who have been referred to the work programme by JCP don't know that's what's happened to them? They've just been told you have to go and see this company at that address, or you have to phone this number, and that's all the handover they get, and they don't actually know. And I'm saying that from my own constituency case load, where you get phone calls into the office and they say we have to go and see this person, and they don't have no idea why or the reasons. Is that too simple?
It's partly true. We were trying to do some research and we put posts up saying tell us if you're on the work programme, and we had to say actually put 6 or 7 prompts. Have you been sent to this organisation? Mm-hmm. Did JCP give you this letter? Did they this? Because people don't understand quite often that they've gone onto the work programme, how it's different. Apart from the only thing they may get is a letter which lists that they might have a problem with their benefit.
And I'm going to bring Robert in because I did promise to bring him in, and then we're going to move on to Graham.
Thank you, Chair. I agree with most of what's been said, so I'll keep this brief, but just on the relationship between JCP and the work programme, I think one of the issues that disabled people tell us is paramount, is the lack of clarity amongst DEAs and the Job Centre Plus about what scheme is appropriate for whom. So there will be some clients for whom the work programme is not the most appropriate form of employment support. There are other schemes out there, things like work choice, but the DEAs aren't quite sure who to refer when. So some kind of gateway mechanism would be extremely welcome in terms of placing people on the appropriate scheme at the appropriate time, firstly, but secondly, kind of addressing the question of kind of information and addressing the idea that people aren't 100% clear on what it is that they're going through, who it is they're going to talk to, what it is they'll be asked to do. So addressing the issue of clarity about programmes and kind of people's own understanding of the process that they go through would be extremely welcome.
I think we might need a handy guide. Graham's got some more questions.
Okay, thank you, Chair. There is some evidence that Job Centre Plus staff are not promoting the potential benefits of the work programme to claimants. Have you found this in relation to the claimants that you represent? And do organisations such as yourselves have a role to play in positively promoting the potential benefits of the work programme? Who wants to go first? Don't all rush at once.
I'm happy to go first if that's okay. I mean, as a second-tier organisation, we don't have as many conversations with clients as some other sorts of organisations may do. I mean, certainly, what we're hearing anecdotally is that it probably isn't being promoted as well as it might be. But turning to what our role in that should be, I think we have to think in terms of, is this a programme that we could realistically and responsibly promote? And I think with the research that we've done with service users, what it's showing us are a number of risks, but that can broadly be separated into the risk of being parked, which is something we've seen quite a bit of, and the risk of being placed in an environment where sanctions are applied with a great deal more intensely, shall we say, than they might be in other environments. So I think if you're asking, is it something that we can promote, I think we would like to see improvements in the work programme to better meet the needs of people who might struggle to engage before we could do that.
Okay, that's great an answer. I'm keen to hear the others. But do you see your role as? I mean, that's an entirely negative answer, if I may say. If you're looking at what we're trying to do here, we're trying to get vulnerable people, in many cases vulnerable people, or long-term unemployed, into a job, and you have the work programme, and the work programme has a lot of positives. And I take on board some of the things about being parked and so on and so forth, but do you not feel that you as representatives have a obligation to say, yeah, there are some negative, there's always going to be negativism around in anything that anybody tries to do to try to help people, and you say, yes, there are some negatives, I've heard some anecdotal evidence, however, these are the positives. And whenever you try to put the positives forward, you'll always get people say, well, I've tried this and I've tried that, but always look as if the glass is half full and think there are positives in there. If you go through this work programme, let us know if there are any negatives, and we will make representations on your behalf. But for God's sake, at least give it a try. Don't use the negatives and the anecdotal information you've heard about to try and stop as a barrier to stop people even trying going through it.
If I could just respond to that, please. I mean, certainly as an organisation, we are entirely supportive of the line of the 2010 drug strategy, which views employment as being one of the routes into sustainable recovery. We are entirely supportive of that. We welcome the government's recognition of recovery capital, and we share that view that employment is something that everybody who's able to should strive towards. I think what we also have to acknowledge is that within the sector, within the drug and alcohol sector, there are programmes which sit outside the work programme, which may actually be more suitable for people with that kind of history, and in many cases are delivering stronger outcomes than the work programme appears to be doing at the moment. So I wouldn't want for a second to give the impression that as a sector we don't see employment as a priority. We absolutely do. But the reality is we would want people to make informed choices, and so there are programmes like Add Actions Next, for instance, which deliver good outcomes, and so it may be that for clients who are able to join that programme, they might be directed in, we might point them in that direction.
Yeah. Okay, thank you.
I'll finish the others and then I'll bring you in. And is it Duncan wanted to answer?
Yeah, I mean, so the starting point for us as Crisis is we're passionate about helping people who've been homeless into work, because we think it's the long-term route out of homelessness and to get people back into society and give people self-esteem and confidence. So, our starting point is we want to get people back into work. We come from a different perspective. We have a small work programme subcontract, though the referrals are very low. That's an issue I might come on to later. But we have continued to run a series of employment programmes from our own resources, even though we didn't win other work programme contracts, because we believe that it's the right thing to do. And interestingly, the experience of our clients is they're getting jobs through the services we're providing, not through the services they're providing on the work programme. And at its worst, work programme provider people have rung us up and said, oh, we've discovered you've got someone a job, can you let us know, because then we'll claim the money. And that, that's been the experience, because they've 58% of people we've surveyed have said that they didn't even feel, not just their needs weren't assessed, but they weren't treated with dignity and respect by work programme providers, because the client groups, homeless people as a client group like others, come with a range of issues and need more in-depth support, which we hoped the work programme would provide. We started out by referring people on an early basis to it, but too often it isn't happening. We want the work programme to work. Lots of government money is going into it. And that should be the basis of doing it. But the challenge, and we would not, when we've advocated for clients and we want it to work, and we advocate for clients for Job Centre Plus anyway. The challenge is that is it actually getting people into work? That's a big question mark over there, and us and other charities are continuing to do so outside of the work programme because we believe passionately in the issue.
I'm going to bring very briefly Gwenda and then Debbie in, and then I'll come back to Gwenda.
Yes, I'm going back essentially to the question that Aidan asked on the issue of people not knowing that someone was homeless, and I accept the point that Job Centre people didn't know the number of hostels in their area, but also the issue of the caution around drug users, of actually laying that on the table. But these people aren't going into Job Centre Plus for the first time in their lives, are they? I mean, what I'm trying to nail down here is that they must be regularly going into Job Centre Plus. They are regular claimants. So where's the gap between the people who must know who they are and actually pushing them in the right direction? Or are you finding that every time they go into a Job Centre Plus, it's a different face across the desk? Yeah, feel free.
Can I just say, in a practical term, Sheila Gilman was talking about people seeing someone for a very short time. What tends to happen in job centres is people sign on with someone who's usually an assistant advisor. And so they will have a very short time with that person. What people should also have is an advisor. And I think that and those people have now become generalists. So in the past, there used to be, for instance, lone parent advisors when people were on income support. And they've got very kind of holistic support. But it's much more generalist support now, but what people mostly see every 2 weeks when they sign on is really short, is an assistant advisor, and is likely to be, could easily be someone different every week.
So it is that fact that nobody really knows who anybody is at the moment.
Yeah.
Thank you.
Yes, Mr. Shrubsole, in terms of what you were saying before about programmes that you're operating and getting good job outcomes, and then the Prime is hearing about that and wanting to claim that. I mean, that's potentially fraudulent behaviour. So could you clarify that and what evidence that you have? I wouldn't say it doesn't happen, but I think we need to be very careful about sort of statements that we make of like that. So do you have evidence to that effect?
Yes, because a couple of individuals in question, did a training programme through us, and we took them on as employees. And then the work programme provider then got in touch with us and said, well, can you give evidence of the employment, because we want to claim that as an employment outcome.
Right, that's very serious.
I mean, I think it's not for me. I wouldn't judge that necessarily as fraud. I think what the question is that the reality of what's happening on the work programme, at all stages, is that it's not quite the clear and comprehensive programme as envisaged. Is that people are just being told they're on the work programme, they go and see somebody, and then they might not see somebody. We've had clients who've been told, one was told don't come back in 4 months' time, or they're seeing them once a month, and it's not that very close relationship. So clearly they're carrying on doing other things, and we talked about high caseloads at Job Centre Plus because of the extent to which the referrals onto the work programme are very highly concentrated on the JSA end, not on which wasn't necessarily envisaged. Again, there isn't much money per client, so they've got high workloads and they wanted to get people into work. So, and DWP's research was clear that people are being parked. That's in a way that's an entirely rational thing on the part of some of the providers. But and then when people are getting help, they're often actually being referred not necessarily to specialist providers down the supply chain, and those specialist providers actually tackling homeless people in London, for example, have all withdrawn because they weren't getting referrals. people are being referred to free courses, other things that are paid from skills funding agency money or whatever. But your work program provider will have a chat with you eventually, and then they might find out that, oh, you've got a job, and then therefore they want to claim that money. So it's a symptom of the fact that there isn't the in-depth support being provided for people, and people who want to get into work aren't going to sit around if they're not being provided that support. They're going to work with other agencies who can. And if people want to work, we want to help them into work, so we're going to carry on doing so.
But the money doesn't follow.
But the money doesn't follow.
It follows.
No.
Presume once somebody's contracted to a work programme provider, that's it. It's almost like a form of bondage. They're there for 2 years, regardless of what happens to them elsewhere.
And the money is following the chain that's one of the challenges about work. The chain of contracts is not following what the individual would actually benefit from.
Graham,
just may continue, Mr. Shrubsole. You clearly see the work programme isn't working in terms of the claimants that you represent. And you have experience of helping them get into employment. What would encourage you to link up with the work programme to perhaps help change the work programme for the people that you represent? And how different would the work programme be with your claimants if you got involved in it?
Sorry, excuse me, it's quite a lot of questions.
Chris, what would encourage you to link up with the work? What would you do differently? Because you've criticised the work programme based on your personal experience, but what would you do? How could we encourage you to work with the work programme to make it work in the way that you've just described for some of your claimants?
We actually do have one small subcontract in the northeast where we were expecting 100 referrals and only got 20. So we are, I said we had a range of roles. We also are part of the work programme in that instance, and that we're not getting the referrals through. And we know that other agencies, Samungo's Single Homeless Project and others, wanted to work within it and didn't get the referrals and have pulled out. So that's one of the challenges, referrals. The second challenge is that point I said about early identification, that if homeless people are identified as one of the early entrance groups, more money can flow, so they should get more support. Secondly, there's a big issue about the extent to which the work programme is based on benefit groups. There's actually, in any way, but also with the WCA process, a lot of people with higher needs are coming along because they're on JSA, when actually they should be getting the level of support that an ESA claimant might get, which again, more money flows. And if you've got more money, then you would hopefully be addressed to more support. But ultimately, the primes need to be much better at assessing people's needs and then building a programme around those needs to bring in the specialist contractors and others who can help them. And it's what's happening in the work programme. And colleagues here will talk from other client groups, but what's happening is actually, rather than the tailored personalised services, it's quite a standardised process, which also is focusing on things like CV, job matching, job search, quite standard, generic, out of work skills, not the how do we help you tackle literacy, debt, housing issues, mental ill health, which is what we all hoped and what ministers promised when they established the scheme.
Okay, so how would you change that standardisation? What would you do about it to cater? Because for me, it's the American term, same meat, different gravy, depending on the claimant groups. What you're saying there is to standardise. How would you, as a group of people, help the work programme to change for the various different groups that you represent?
Well, I think some of it is identifying where things work well, and in the written evidence that I gave 3 examples of where the work programme had worked particularly well for 3 single parents. One provided really excellent service, but it was about, for all 3 of them, it was about also recognising that they were a parent and giving quite an imaginative service. So someone wanted to set up their own business, the work programme printed flyers for them. They sent out, they paid the postage for that. They paid for that person to go to a job interview in another city. I think they did really amazing things, and I think one of the roles of the work that I do is really to show where things do work well, so that practice might be shared. But I'm unclear how that practice is shared, and also how it's dealt with when people get a very poor service, who I'm going to talk about it later, but in terms of, are actually turned away from the work programme because they've got children. They can't actually physically get into the offices of the work programme when they've got children. and then are threatened with sanctions. Well, that's obviously very poor practice, but that is going on. But yes, I think there is a role in showing where things work well and where the work programme has worked well, and I'm more than happy to do that.
I think from a scope perspective, I would strongly take it back to the issue of assessment. So one of the things that we're seeing is a huge numbers of inappropriate referrals coming through, people who are being found fit for work, who are a long, long way from work. And the problem we have there is that people are coming through the work capability assessment, which is a test which is effectively assessing medical functional capability rather than assessing readiness for work. So, for instance, the idea that if you can stand up in the shower for 15 minutes or something, you're then able to go into work, seems inappropriate as a way of measuring distance from work. So, actually, in terms of your question about improving the scheme, one of the things we could do would be to look at the work capability assessment and look at if there's a way of actually introducing a distance from work test, which looks at the kind of the readiness for work.
And in fact, we're in danger of answering all the other questions that are on our brief in this first one. So remember, we're actually meant to be talking about Job Centre Plus and the handover. Glenn, very briefly, I hope it's on that, and then we're going to come back to Glenn.
Could I just ask you said, and we've heard this before, that the primes don't refer to you. When they obtained their contracts, had they quoted you and the other organisations you referred to as being people they would refer to? I mean, did they include your names?
Where we have this one subcontract in the northeast, we actually entered it after the work programme was initially launched. It was a later negotiation. I think the core question is when people listed who was on their contracts, there wasn't much differentiation in the public announcements between whether they were end-to-end specialist subcontractors or spot subcontractors. And where a spot contract could just be, we might use you to do a couple of job coaching lessons or use your furniture workshop or whatever. So their name might have appeared, but actually what potentially they would offer wouldn't be very in depth. But what's happening is that those spot contractors aren't being used pretty much at all because there's still an expense involved, and many of the primes and the subcontractors are wanting to use other free courses instead. And then the subcontractors, what's happening is that many of the people being referred to them might not actually be of the client group that they were set up to serve. So we've one of the things that Crisis does is run a network talking to over 200 small and specialist organisations across the country, and some of them have managed to make the work programme work, but you can effectively either make your subcontract work or you can serve the client group you were set up to serve. Most people can't do both because the referrals you're getting are just whoever the prime has decided to send to you. You might be a disability charity or a homeless charity or whatever, and they're sending you a range of people with a range of needs. You do what you can to help them with the best intentions and do what you need to do to meet your contract, but that won't necessarily be doing what you're set up to serve, which is homeless people or disabled
yes,
people.
Yes, but I mean, what I'm trying to drill down to here is the government, when we've asked these questions, and indeed in a variety of ways, of the most vulnerable and the hardest to reach to get them into work, argued that the primes had a responsibility to actually engage with those specialist groups. You're all representatives of some of those. And that seemed to me to be contingent upon the primes being awarded the contracts. And what I'm trying to find out is, did they actually exploit you to obtain contracts, and now they are, as you've given, I think, fairly telling evidence, simply parking the most difficult?
Could I possibly say a few words, if that's okay? I think unlike the homelessness sector, the drug and alcohol sector is actually quite represented on work programme supply chains across the country. I think there are several organisations delivering, and in total about 35 contracts. So there is, broadly speaking, there's at least one specialist subcontractor in each CPA. So in a sense, we've got quite a good overview of what's going on in terms of where the referrals are flowing to specialist organisations. So really, it's to back up what Duncan said, in that for the organisations that are delivering on a spot purchase basis, we've seen very low take-up of that. So there's one organisation which had anticipated around 1,500, possibly a little bit more referrals in the first year. That's across several contract package areas, that has actually received 4. I've spoken to another organisation which is delivering end-to-end, and what we've seen there is something very different, which is a much larger number of referrals, which, again, as Duncan said, they're not necessarily a good fit with their expertise, but the one thing they have in common is that they're all a very long distance from employability and long distance from the job market. And you might see that as being quite rational behaviour on the part of a prime, because you outsource that risk, let somebody else provide the service at some cost, and you hope that at some point a job outcome payment and sustainment fees come in. So we're seeing a real mix depending on what type of subcontractor an organisation is, really.
The bottom line to all this is that your client groups are not getting the absolutely tailored, flexible service that the government told us they were going to receive.
We haven't seen that so far.
Thank you.
So what gets back to the original question is how well are you engaging with the work programme to try and get that tailored service for the people that you represent? But if I may, Chair, can I just ask Sophie, what do you regard as good practice in terms of the handover coordination between Job Centre Plus and the work programme based on the people that you represent?
What we'd like to see, and what doesn't exist at the moment, is a really good assessment of what somebody would need in order to get back to work. So what is it that's holding them back? And obviously the WCA is looking at their functional capabilities, but if you're talking about someone with mental health problem, it'll be issues to do with confidence, anxiety, it'll be issues to do with employer attitudes that are going to be probably the two big issues, as well as their actual mental health. So a proper assessment of that. We do find some job centres, Job Centre Plus, that are doing that, and in fact, having done that, they're thinking this person isn't appropriate for the work programme, and they're encouraging and supporting them to appeal, or they're sending them to a local mind where they can get support to appeal, or they're sending them to work choice. And one of the things that we're finding is that the DEAs in Job Centre Plus are absolutely, because you can only send a certain number of people to work choice every month. At the beginning of every month, they're sending off huge numbers to work choice, because they realise that you actually get a better service in work choice than you do in the work programme. And just to have a little look at what that's about, it's about a specialist understanding of what an individual needs. It's about doing that in a much more supportive environment, so that it's not couched about with this sort of sanctions, mandation, culture, which is quite difficult if you have a mental health problem, because, as I said, the issues are confidence, and that's sort of akin to a psychiatrist saying, pull your socks up, it's your problem. It's not an encouraging one. But the other thing as well, and in the best services in terms of getting people back to work are actually the ones that are based in health services, IPS. So there's a really good evidence base for IPS, and they're dealing with people who have moderate to severe mental health problems. They're dealing with people in secondary care, so that's not an easy group. But what they do that's different is it's integrated.
You used an acronym, IPS.
Sorry, it's Independent Placement and Support, and it's a very radical approach. It says let's get somebody into the workplace very fast, within a month, and then support them when they're there. So it might not be full-time work, it might well be under 16 hours, but it's work, and it's a recognition that people want to work, that they can work, but that the issues aren't to do with their motivation. It's to do with confidence, it's to do with employer attitudes. But the key thing that does is it integrates, because it's based in health service and it works very closely with the employers, it integrates the health and the work advice. And one of the things that the work programme doesn't really do is integrate that, so people are getting a different advice and a different message and a different service from health than they are from work.
So what sort of communication, what liaisons have you had with the work programme to make those changes that you've just
Well, we've tried to work with different providers. Some of them are trying to set things up. Some of them will have they'll have counselling support and all sorts of things. But actually, if part of the expectation, rather than based just on the goodwill of providers, if part of the expectation was that they did integrate with the support that somebody was getting from their GP or from their secondary care, their psychiatrist, their community care support that they were getting, if that was part of the expectation for all the providers. I think that would really make quite a significant.
And are you making representations to the work programme to put that coordination in place?
Well, I just have to see if my colleague nods or
because what I noticed, because there's lots of good ideas and suggestions here, Chairman, but you've got to, the work programme's working to a greater or lesser degree. How do you improve it? And anything one tries, you've got to make a start. A journey of 1,000,000 miles starts with the first step, and you can change it on its way. But if you just say, well, this doesn't work, that doesn't work, we're going our own way, rather than say, well, let's look at the work programme. How can I improve it for the people that I represent? You're not doing this. Why are you not doing this? And explore the ways that you can improve it.
Well, we think it needs to be part of the system, because at the moment some providers are doing one thing and some are doing another, and there's an assumption that work programme providers will come to this on their own. And actually, so we've been talking to the DWP about making that part of the expectation. Right. I mean, we have had conversations with individual providers.
No, I tell you, we're getting back to. Actually, you're answering all the other questions that we've got.
Sorry.
And everybody's asking all the other questions that are meant to come up. This section was meant to be about the coordination with Job Centre Plus and the work programme. We've got all the questions on the black box and everything coming out. So can I just stop this discussion there? I'm sure everybody will get a chance to say what they want to say just later. But Graham, you've got a question on sanctioning and mandation. I'll get you to ask that one, and then we're going to move on.
Okay. Do you accept that mandation and sanctioning has a role encouraging participants to engage in the work programme?
I'd really like to start on that one. I don't think for mental health it works as an encouragement, and I used the metaphor before of a psychiatrist that's telling an individual to pull their socks up. For us, it has exactly that impact. So for somebody we know that people with mental health problems have one of the highest want-to-work rates. They're very keen to get back into work. But confidence, anxiety about their ability to do that is the issue. So sanctions and mandation, right from the beginning, is a sort of a wrong prescription based on a wrong diagnosis of what the problem is. But the other problem that we find is that people aren't really looking into the reasons for why somebody has missed an appointment. So there was one person who reported to us they had actually been there in the waiting room, but their anxiety levels were such that they hadn't, when somebody had been saying, well, they're not here and that's terrible and we're going to have to take steps, they didn't even feel that they could say, well, I am here. So they went away, and then letters followed, and so there's an assumption that people are acting in a particular way, which I just don't think fits the facts, and it does then have quite a negative impact on individuals on precisely this issue, their confidence levels to progress. So we'd like to see a different approach. Work choice, where people are involved voluntarily, has actually a much better outcome. So it seems to us there's a message there about sanctions.
I think the issue around conditionality is whether it supports the policy intention of supporting disabled people back into work. The DWP evaluation of the work programme has found that the conditionality and sanctions is making people's lives harder without necessarily making them more likely to meet the programme requirements, which implies that it's not supporting the policy intention. I think the issue with conditionality is that in supporting people back into work, we have to focus on all of the barriers that they face into work, whereas the conditions and the sanctions are focused on one particular barrier, which is a lack of motivation. So it's saying if you're not motivated into work, you don't attend the appointments, we will sanction you, rather than saying, well, what are the things that will help you? What are the things that we can incentivise? What are the steps that we can take that will reward you? The evaluation showed some clear themes of things that do work, things like building human relationships between advisors and individuals, being able to involve users in their own journey back to work, being able to kind of say to a disabled person, well, what are the things that you would like to do? What are the things that we can support you to do? How can we work together to make this work better? And the third aspect being sort of related to that, which is actually finding a placement that meets the aspirations of the individual. So rather than just finding any placement saying, well, this is something those things will help. Conditionality doesn't appear to be working at the moment.
Building on that, I mean, of the more than 300 people that Crisis got into work last year, we did it through a positive coaching methodology, which was about saying, where do you want to go? Let's help you aim for something. These are people who've been often had negative experience of education or previous employment, and actually saying to them, what are the things? Where do you want to go? What are your aspirations? Realistically, challenging, often tough love, but it's about trying to achieve something positive, not just look at the negative things that have happened. And research is clear: 77% of homeless people want to work now, 97% at any one time. Yet a fifth of them, in a year's operation of the work programme, have been sanctioned. And DWP's the research that was done DWP's own research, that was done, highlighted how many of those who've been sanctioned were sanctioned because of confusions over the JCP work programme relationship about when the initial meeting was to happen. So sanctioning there may be a place for sanctioning, but the evidence so far is that sanctioning hasn't been applied correctly and it hasn't helped people. It's been more of a barrier. And actually we've seen letters. The first letter that people have had from a work programme provider has not been, we want to help you on your journey, of course you need to do these things. It's basically been, hello, turn up. If you don't turn up, we'll take your benefits off you. And actually that's not the start of a helpful, productive relationship to get people back to work. So we think the whole, and it does, as everyone has said, it increases anxiety, trepidation, an unwillingness to disclose because you think whatever you might say might be used against you. And actually, when people get back into work, it's because they're positively encouraged and supported to think differently and do differently and have aspirations to achieve, rather than thinking, what do I need to do in order to avoid a penalty?
Yeah, I'm sorry, I know you've got lots to say, but we do have your written evidence as well, but I'm going to move on, otherwise we'll never get past the first section. So
Could I not just get one case, because it's just, it was something that happened at the weekend. We have an online forum, and I had someone who has been sanctioned. She has an 8-year-old child, and all of her appointments are either given at 9 o'clock in the morning or 3 o'clock in the afternoon. And this last Monday, she took her child out of school so she could make a work programme appointment. Her son is 8. I mean, it's just... Is that the point of a sanction, that you want to encourage people to take their children out of school? I had to say it because I...
You said it, and on to Stephen in his
Let's move on to the black box. Quite a lot of it's been covered already, so we can probably go through it quite quickly. But as we all know, the black box concept, which was taken from Australia, was supposed to be the silver bullet that would allow creativity, imagination, would allow specialist providers who had the expertise dealing with particular groups to play a key role in the work programme. Now, clearly what we're hearing indicates that doesn't seem to be working terribly well. So let me drill down on a couple of questions so I can be quite specific, because it will assist us with our report. In your judgment, do providers need to be free from the overprescription from government about the services they deliver, in order that services can involve and be responsive to the needs of different claimants? So essentially my question there, we can answer very quickly because I've got some more detailed one afterwards. The principle of the black box is you don't have overprescription from the government. Do you think that's a good thing or a bad thing in principle?
If I can just say a couple of words about that. In principle, yes. But I think the black box, in conjunction with incentives that aren't necessarily aligned to somebody's needs and barriers, and a complete absence of minimum standards, does create an environment within which people can receive an ineffective, or in some cases completely lacking, service.
And I think we've heard enough disturbing stories, really, to feel that there just needs to be quite a lot more transparency. So there's one thing to have a black box to encourage innovation and people to do new things, although I'm not sure that we've seen anything that's really that innovative, to be frank. But actually the black box also means that there's a lack of transparency about how people are doing things, and we'd like to see a lot more that's about ensuring that people are treated with dignity and respect and not parked, and that is much more evident to the outside world.
The single parents I interviewed wanted some predictability, and I don't think that precludes innovation. And in fact, I think some of the people who fared the best were ones that knew exactly what was on offer. If they were not going to be seen as frequently, they'd say, right, well, I'll see you a lot over a time that you've got a job interview. So it's really clear where that, that there was a predictability and an understanding of basics around the service.
So a very, very clear communication to each client of exactly what they were going to be receiving?
Yes.
Okay.
Duncan? I agree with everything about need for transparency, better diagnostic tools. The challenge is the black box is being asked to do two different things. There's one thing which says we as the government ask you as a provider to do whatever is best to get someone back to work. And there is that flexibility, if it was there in reality, would be good. But the black box is actually also saying the government has said we give you, the prime provider, the ability to devise whatever supply chain you want. So if you were going to a disability charity or homeless charity saying do whatever you want to do to get people into work, that would be one thing. But the black box has meant the prime provider, based on, as Paul said, a payment mechanism which isn't supporting the most disadvantaged into work, the prime provider is being left to devise a supply chain, and what they're doing is they're hedging the risk that they put in, they're working with the easiest to help, they're behaving entirely rationally in that black box to protect their income stream, their contract and all the rest of it. But that isn't the same as giving a black box approach to the client on the ground. So we've ended up confusing two things: a flexible approach to help a client with an individualised tailored response, and a hands-off contracting where DWP says we don't want to individually subcontract like we used to.
Is one of the challenges then that in a sense as groups representing clients with particular challenging needs, understandably you would want a minimum standard. I can appreciate that. By the same token, you'd want an element of transparency so you could see what works within a black box and what doesn't. The problem with that is the direction of travel eventually means, well, actually we won't have a black box, we will just have a set of minimum standards and guidelines that we all adhere to, which means you'll lose the creativity. So maybe another way of looking at it with the black box, actually say, well, forget all that. The only thing that counts is the outcomes with the hard-to-reach groups. So maybe another way to really set the creativity of the black box concept free would be to say, forget about minimum standards, forget about transparency, forget about that. What counts is you get 75 homeless people by the end of the month for a job, or people with mental health problems. Is it perhaps sensible for us to go to that sort of creative extreme? Because otherwise all the things you're describing, which I wholly understand around minimum standards and transparency, actually ends up with you don't have a black box concept. Robert, you answer, then I'll let my colleague come in. David?
I mean, I think that's an extremely interesting point. I think the issue for us around the black box is the question of accountability. So how do you hold providers account for delivering the services that they're intended to deliver for disabled people? And I think, one issue in terms of how we get around that is involving disabled people more. And I think, in terms of how we can allow providers to have innovation whilst holding them to accountable for meeting a kind of central government, set of things that need to be done, would be to have a kind of devolve the question to disabled people, so involve disabled people more in the initial planning process about what kind of support they'll receive, and then once that plan has been agreed with the disabled person, then use that to hold the provider accountable. And I think that would get around to that issue, if that makes sense.
Sorry, David.
Thank you. I just wanted to get the comments from the other members of the panel on what Mr. Shrubsole said, which was really that a financial model is driving what is being provided, rather than it being the innovative and flexible and person-centred interventions according to what is the what the client needs. Is that what you would all agree with?
I think that's certainly what we've... Obviously, this doesn't apply to everybody. None of this applies to everybody, but that's certainly what we've found. And I think one of the problems, and perhaps this relates to Stephen Lloyd's question as well, is that the system, even if you said it's going to be based on, getting so and so many people into work, such and such a proportion, because you would then go for the people either that are going to bring you the most income or that are easiest to get into work. And so long as you could come up with a financial incentive that was sufficiently nuanced that it really did represent the amount of support and the amount of time that you'd need to spend on getting somebody into work, that would be fine. Because people are going to be motivated by whether they think they're going to be able to make a success of that individual client, because they're businesses, and they, it's payment by results. They're not paid if it doesn't happen. And at the moment, the system isn't that nuanced.
Yes.
I could ask one more question very quickly from each again, if you would, because it sort of feeds into the report. What would you define good employment provision looking like for the claimants you represent? Let's start with Sophie for a binder. By the way, Sophie, I'd be grateful if you could send to the clerk the information that you had about
IPS, Independent Placement of Support.
I'd really like to
Yes.
see. That's very interesting. So each of you, very, very quickly, because we've got many more questions, what would you define for your client group to be a good employment outcome? Starting with Sophie.
A good employment outcome or a good employment service?
Good employment provision, sorry, good employment provision.
Well,
good outcome would be a job. Good employment provision.
Exactly.
Good sustainable job.
A good sustainable job. Well, I'd go back to IPS actually, because I think what they do is probably sums it up. It's integrated with health, which obviously isn't going to be relevant for all the client groups, but it's integrated with health, but with other needs, so housing or debt or other sort of advice that people might need. It's extremely ambitious on behalf of the person, so it looks to their aspirations and is uncompromising in saying, yes, you can get a job, and being supportive in that way, but ambitious without being punitive. So it assumes that the person, can and does want to cooperate, rather than starting from the assumption that the person's motivation for a job might be low, and then builds on that, and that's extremely successful within.
Good. I'll hold you there, Sophie. That's very good, because I want to get everyone in before the others. Yes, Paul, quickly.
Yes. Well. In a sense, there's no great secret to it, but lots of organisations are doing it. Again, I think it's a multidisciplinary approach, so something that brings in health, psychosocial support, people who are skilled in supporting people to deal with other barriers that may have, which could also include housing. A lot of provision includes accredited training. Some agencies use something which is very similar to the IPS approach. Others will do more to engage with key employers, support people through that.
That's really important.
And I think also, as a final thing that's very possibly of particular concern to this sector, is staff who are in effect skilled intermediaries in liaising with employers about the individual concerns they may have as employers about recruiting people, the histories of drug dependency and in some cases criminal records.
Good, thank you, Laura.
I'd echo some of those points. Single parents are a very broad group, and I was quite struck by quite a lot of the single parents that I interviewed who were perfectly well qualified. Many of them were teachers, social workers, psychiatric nurses, a whole range of pretty qualified people, and it was just that there aren't the jobs for them to do around their children. So again, I would say about working with employers, and I know the local partnership agreements that job centres have isn't as strong with the work programme providers. Those things take a time to build up. So I suppose it's for single parents that aren't as skilled to help them in training. Some of them haven't been in employment and they basically need a basic computer course, but also helping those that have got qualifications to work with employers and the public sector to have a role in thinking about how jobs are designed. I had an example of a single parent who's a qualified teacher. The work programme has paid for her to do a food hygiene course, and she's to become a dinner lady. In terms of conditionality in the longer term, although it might be some stepping stone to work, I'm not quite sure whether that's making the most of someone's skills, and I don't think it's going to sustain them into the future, and I think that will just mean they have more contact over time with the job centre, and it's not going to help them sustain their families.
I mean, I think childcare provision and growing
Yes.
that, but that's for another day. Duncan, and then finishing with Robert.
I mean, agreeing with everything everybody else said, crucially you have to take an employer who link an employer with an individual who wants to work and provide everything that's needed in the middle to tackle issues and motivate people to be able to go into a realistic job and make a success of it. I think one of the things that we talk a lot about is that the work programme at the moment is very generic, and there are groups of people, many of which we represent, who need some kind of pre-work programme support, and we need joining up between the skills agenda and the funding of that and what's going on in the work programme, and they kind of remain a perennial problem of government. Those two bits of government remain entirely separate. Just lastly, going back to your earlier question about how we might see the work programme, actually, one of the challenges that actually we as an organisation, not all would take this view, but as Crisis, we've said we believe in our employment services enough that we would actually go out and fundraise or seek money from other sources to get people into work and be paid by our results, by whether we achieve it. But you can't do that with the work programme currently because of the way black box is a rigid box and a contracting line that people are pushed down. It isn't payment by the results you achieve. It's in terms of getting people into work. It's payment by whether you do what was on your contract, which was all that was available.
That is a very, very useful and important point. Thank you, Duncan. I know it will be noted. I've certainly noted it. Robert, very quickly.
I would also endorse much of what has already been said, particularly Duncan's point there about pre-employment support. But I would make 5 quick points, if I may. Firstly, good employment services give you time to build relationships with the client. Secondly, placements that meet the aspirations of disabled people. Thirdly, user involvement, so you get disabled people themselves involved in defining the process they'll go through and the modules of support they'll receive.
And the coalition expanding access to work to include work experience internships, I would assume you would endorse heartily.
Absolutely endorse that.
Good.
Yeah. Fourthly, try and have a focus on non-employment outcomes. So for a lot of disabled people, the work programme is kind of medicalising people, saying that you have an X amount of time before you'll be better, and once you'll be better, you'll be able to get a job. But actually, for some people, kind of voluntary work experience, work in the community is actually a real achievement and something that's of benefit to society. We should recognise that. And finally, the point that others have made about kind of wrapping around services around the individual. So things like social care, I'm thinking of in particular, childcare is another excellent point. 5 quick points.
Thank you.
Jane wants to come in.
Yes, it was just to follow up on something a couple of you mentioned about the liaison, if you like, with employers and the need, particularly with sort of, hard to reach groups or people who are, further away from the world of work. A lot of employers, a majority, I imagine, don't really have a lot of insight into, how the specialist needs and how. So I just wondered, as sort of advocacy groups, how much work do you actually do or contact do you have as different groups with employers, and through what medium?
We put a lot of effort into working with employers because we know that ultimately you until they see the whites of your eyes, as it were, and you can tell them that actually a homeless person can achieve things and this is the support we've provided and they will be good workers, and here's an example of someone else who's done it before. That's the key to getting them into work. And we have employer partnership events where we get employers to meet potential clients. We do work placements and various things like that. One of the challenges about the work programme is that in some instances it's cut across what had become quite well established relationships with employers. So partly in the sort of scramble for jobs, some areas have developed good vacancy sharing arrangements, which were quite open, that employers become and organisations that might be best placed to do it. And now actually people have gone, well, that's my employer, so Job Centre Plus is keeping that set of employer relationships, the work programme provider separately trying to do it, the charities trying to do it separately. So that is a real challenge, and it goes back to the closeness of the relationships. But if you're having to use a work programme provider who has only a set of other relationships, it's unlikely. And they're trying to get people into work. They're going to go back to, they're going to suggest to the employer the person who's more readily going to appeal and look like they're going to make a success of it. And the homeless person or the drug user or the person with mental health issues is not likely to be pushed forward. We do that. We have to rely on doing that ourselves to make the employer work.
Okay, so you have employer events, was one of the things you said.
We do a lot of work with employers. One of the things that we know, employers are, part of society. They share the same prejudices as society. And one of the more recent, slightly discouraging findings that we've had is that 40% of employers think that people with mental health problems would be a significant risk as an employee. So we're quite up against it in that respect. We've got 2 big campaigns. One is our Time to Change campaign, which we run in conjunction with Rethink Mental Illness, which is based broadly at society, but has had specific and does have specific aspects that are based around employers. They're focused quite a bit as well on employers supporting people that they already employ. One of the things that we find is employers think they don't employ anyone with mental health problems. Once they realise they do and they're good workers, obviously that changes their attitudes towards recruitment as well. So that's one of the pieces of work. And mine has its own campaign, Taking Care of Business, which is working very closely with employers on developing their policies, both recruitment and HR's and management approaches, so that they can work much better with employees within the business. So that's where we're working generally with employers. But I think Duncan or Rob pointed out earlier that when you're talking about trying to get someone into a job, that is making a particular connection between that individual and that employer, and thinking through some of the very practical concerns about that particular line manager, or the particular flexibilities that that individual will need. And all the work that Mind or other organisations can do with employers won't substitute for that individual piece of work that needs to be done with the individual when you're talking about trying to get someone a job.
And also, I mean, we don't do direct work with that, but I suppose we work with the Working Parents Group, and we do work to try and influence how jobs are advertised and about the legislation around people starting work. Because at the moment, if you're starting work, you've got no right to request working flexibly, which is a big issue for single parents entering the workforce. And so we do those sort of broader issues, and also around the role of the public sector in how jobs are advertised, because I think some of it is a kind of structural thing anyway about jobs, and organisations like Women Like Us in London have done research on the jobs that are advertised part-time, and actually they're the most poorly paid jobs. Only 1 in 17 jobs pays pro rata 20,000. So I think in terms of, yes, you can do work with individual employers around saying, oh, why don't you advertise a job part-time, but it's a kind of more kind of endemic attitude about quality part-time work.
Just picking up that last point, I mean, would you, if you were sort of advising someone then, would you be sort of a bit discouraging about going for one of those jobs that you thought was poorly paid? I mean,
no, I mean, I think there is a role for jobs being a stepping stone, but I think the overall policy about single parents moving into work, and the whole sort of principle around it was around addressing children's poverty, and I think there should still be a place around trying to make the most of people's skills. I think there's a balance, but yes, I think that some jobs are a stepping stone. But if you're looking at as a government, if a government is looking at the longer term and whether they want to address the poverty of this group, I don't necessarily think if people are qualified teachers, social workers,
you'd advise them to stay on benefits, would you?
No, I wouldn't. But what I'd want there to be more effort to try and design jobs. A lot of those are public sector jobs that could be designed better. Job shares. Maybe the government should subsidise job shares in the public sector if they need full-time hours. That economically might be better and might help lift families out of poverty than getting someone who's a qualified nurse to go into, I don't know, a very part-time job being a dinner lady.
Job shares are there now. My 9-year-old has a school. He has 2 part-time teachers. It's job share.
Still the exception, though.
Okay, personal experience.
Need to move on. Anne-Marie's got some questions now.
Stephen very sensibly asked you what good looked like, in effect, in terms of the experience in this black box. They do say that what gets measured gets done. The answers you gave to his question had some common themes, but clearly they were different given the different groups that you represent. Is there any way that you could articulate and describe what quality is, and could we and should we try to measure it in some senses to get us away from purely looking at the finances, which is actually the focus now on the prime measure, or indeed the alternative suggestion which Stephen came up with, which is looking at outcomes, as in, did you get the job? Do you think this issue of quality is one that we could articulate and one that we could measure and should measure?
Could I just start off by saying that I'm aware that in some similar systems, so in Australia, for example, feedback from users of programs is sort of as a matter of routine. I mean, that might be one step to addressing it. I think a broader approach to quality assurance, and obviously we're well aware of the evaluations of different sorts that are in place for the work programme, but my understanding is that really they will pick up the experience of different groups as part of the process, but that's not part of the intent. So they're not in any sense a substitution for a different approach to quality assurance. So I think certainly it's something that we would welcome. I think in terms of moving away from outcomes, and I say this entirely conscious that it's somewhat swinging against the tide, I think for some customers, not necessarily entire customer groups, but for some people within those groups, the reality is that it will take rather more than 2 years of what can be sometimes a very light touch programme to move people into employment. And I wonder if there might be some merit in looking at steps towards employment. So I know this will start to look a bit like a minimum standard or a distance travel model, but I think maybe the department should consider whether or not for some customers there would be value in that, because it might move providers away from the feeling that if somebody can't go all the way into employment, then there's not much point in doing anything because it doesn't count.
Okay, I suppose my concern is that might then land up just being, if you like, a financial measure rather than a genuine quality measure, because there's a difference between a minimum standard and quality, if you see what I mean. And if you're trying to up the game, I understand where you're coming from, which is trying to ensure that there is progression, which moves along the quality, if you like, spectrum, but in terms of ultimate quality.
Yes, I see what you mean. I suppose in a sense there are two different aspects, aren't there? There are things that you could do to try to drive quality, and there are things that you could do to try to monitor quality, and they're not
the same.
Yeah, if that...
It does. Any suggestions how we might do that? Apart from your STEPTA programme, how could you actually measure quality?
Well, so, I think, first of all, taking a very systematic approach to the customer experience, as self-described by the customers, would be one step. And I think also whether, in a sense, given that we're now talking, the Minister is now talking about a perspex box rather than a black box, if DWP could take more interest in what goes on inside, even if it retains that sort of hands-off approach.
Your approach to this is very much getting feedback from the user groups. What about an independent assessor? I don't know whether you've got some thoughts about that. Sorry.
There have been in the past, and I think there might be value to seeing if that could bring about some change in future.
Might be, or from your review?
Well, I think from my position, I think there would be, to be clear about that.
Sophie, your thoughts on quality and whether we should measure it and how?
Whether we should measure it, yes. How, I do think it's difficult. Obviously, the ultimate is, did somebody get a really sustainable job out of it? But I think there are interim points for people. This is a 2-year programme, and for some people 16 hours might be something you haven't reached yet, or you might be in voluntary work. And at the moment, if people don't think you can get there in 2 years, obviously the incentive is to park you. Now, it may be that you'd get you into voluntary work and park you there instead, but at least you've got a little bit further. So there are these things about the quality drivers and actual quality and how they intersect. An independent assessor might well be a way of beginning to get to the bottom of what's happening and maybe to help understand those drivers a bit better and to adjust them so that they are more useful. So I do think an independent role could be helpful, at least in that respect.
Okay.
And one of the things about what quality would be and how you would measure it, and people might say, oh, this is much too subjective, but for people with mental health problems, one of the big issues for them is confidence. So actually something which looks at individual satisfaction with the process and whether they feel more confident to be able to get a job actually would be a genuine measure of their then ability to look for one and to project well in an interview and all of those things.
So in a sense your measurement, rather like Paul's, is if you like a staging approach and looking at, if you like, the smaller and then increasing outcomes. What about the intervention itself? Because I think one of the comments Laura made was actually there hasn't been much innovation here, actually. Much of the same old stuff is being rooted out. And in a sense, if we're measuring just the outcomes, is that going to help us motivate this whole innovative piece, which isn't there, to get some quality, which is a quality not just of the outcome, but of the tools that we're using to try and, if you like, raise the game? I don't know whether, Laura, you've got any thoughts on that?
Yes, I mean, I think it should very much be rooted in the experience that people have had. I mean, and it wouldn't be that difficult even now. I mean, the thing that worries me is that time ticks on for a lot of people, and a lot of people aren't having any intervention at all. And they could be on the programme 2 years and be, you know, what's going to happen to those people? I mean, I think as a first measure, there are not that many people that have moved into sustainable employment.
Yeah.
So I mean, interview them, find out what worked, be a bit sort of positive about it.
What's your definition of sustainable employment? Because a lot of you mentioned that word this morning, and I'm not clear what sustainable is.
Well, there are different payment groups, aren't there? So if someone gets into work for 6 months, they get a certain payment, and if they're in it for 2 years, which obviously it won't have kicked in for some people. But the current measurement is those that have been in employment for 6 months.
I'm conscious that they get paid after someone's in work for 6 months, but is that your definition of a sustainable job? Or Duncan, you mentioned it earlier as well. Is that basically not kind of, you know, sort of short-term shelf stacking at a supermarket? That wouldn't be your definition of a sustainable job, or any job.
I think there's
but you wouldn't. But you sort of laugh. Is that you wouldn't define that as a job?
Well,
no. There's a difference between it as a job.
Yeah.
We think any work is, providing it's safe and legal, is good in terms of experience-wise. And many of the people we get into work will be doing also. There's no snobbery about it. You get into people into work that they can do it, and sometimes it's 0 hours contracts because that's the nature of the game, or it might be 2 months or whatever.
You take the view that any work is good.
Providing it's it's safe and legal, as I said. So not, and there is a lot of work out there which isn't safe and legal because it's gangmasters and it's under the radar.
I mean, Laura was saying earlier she would encourage someone to be a dinner lady if they'd been a teacher.
I wasn't saying that, and it is still work. What I'm saying is, if the agenda for getting single parents to not rely on the state, not rely on tax credits, not rely on housing benefit, that it seems very short term to just automatically think that someone will go into a very low skilled job when they have skills and they have qualifications. I think it's very short term. I agree.
Why?
That
is there not a dignity in work? Is it not good that they get back into the workplace?
Could not being a dinner lady least being a teacher I'm saying
again,
if the
working
longer
in a school?
term. I mean, it's quite common. If a single parent is going to be a breadwinner of a family, they're going to be the person that's going to sustain that family into the longer term. I agree with you, and lots of parents want to move into work, and they want to, and they see lots of very positive things about doing that, about pay, about being a good role model for their child. But I'm just saying that you might just be creating a time bomb around conditionality for that group if all you're relying on is the jobs that are advertised part-time, and you're saying that you must take. You can be much more restrictive as to the jobs that you can apply for, because you need to work part-time because you also care for your children. I'm just saying that if the government policy is around addressing child poverty, that might not be in every instance the best thing to do.
Work's not just about an income, is it?
No, it's not, but there are other programmes. There are programmes that have happened in America around sustainable work that has been about not necessarily work first, that's been about holding on for a job. I mean, say for instance, I work with someone who was told to go, this wasn't the work programme, it's the job centre, was told to apply for a job that was miles away from where she lived. She is a single parent, she has no other family support, she has a 6-year-old child. She's a qualified graphic designer, and that's what she did before she had her daughter. And she was going to be sanctioned if she didn't go for this particular job that was an hour and a half away, and she was very worried about it. In the end, she found out more from our organisation about some of the flexibilities that might be open to her around the hours that she worked, and she sort of stood her ground a bit with the job centre. The job centre then worked with her, and other agencies worked with her, and she's now she works in an art department of a school, And it's a job that is near to where she lives and is sustainable for her. It's sustainable because it's about her in the round, and it's a job that has prospects. It doesn't pay as well as being a graphic designer and the job that she used to do, but that's a sort of stepping stone job.
But that's based on transport.
Was the other job?
That's different from the nature of the job. That was
It's a bit.
the
It's a
original
bit of
job
both.
was too far
It's a
to
bit of
commute.
both.
That's different from actually
Sustainable
being-
work for one group, for single parents, is seen as being a more local job, of being part-time and of being a flexible employer that allows them to sustain that work. Otherwise, someone will cycle back to benefits.
I'd like to just add a couple of things on that, because I think it's, for people with mental health problems, there's lots and lots of evidence that work is a really positive thing towards their recovery, but there's also really good evidence that the wrong job is actually bad for your mental health. So you do have to take into account somebody's mental health and what will be a stressor for them, but also somebody's aspirations and abilities. So I think obviously those are two things which can make a job, even if it's legal and safe, can make a job actually not a good choice for you and not sustainable in the long term. But the other thing is that for sustainability, the job that you do, whether it's being a dinner lady or a shelf worker, might be sustainable if the support that you get continues, so that when actually you've built up your confidence and you are a little bit weller, the support is still there to help you get to the next step, which might be, working on a till, and then the next step might be that you, eventually move into management or become chief executive of Tesco or whatever it is. Those things are available to you, but only if the support continues and the support to the employer continues, so that they can see that just because you've got a mental health problem doesn't mean that shelf stacking is all you can do. So I think there are both sides to that. Shelf stacking might turn out to be absolutely the wrong thing or absolutely the right first step, even if you have, your abilities are way beyond that.
Right, back to quality. Corlett, you came out with 5 points, didn't you, in terms of what you thought good looked like. So what's your take on quality? How do we measure it? Can you?
Okay, yeah, I think that I would strongly come down on the side of kind of user experience and user perspective. I think that one of the things that's conspicuously absent at the moment from the kind of evaluations that we have of the work programme. We have the statistics which show that the work programme isn't working for disabled people. 1 in 3 of people on the scheme are disabled people, but only 1 in 5 job outcomes is for a disabled person. We have those figures, they're pretty clear, they're pretty damning. We have the evaluations that have been carried out by academics, which are telling us some of the things, but one of the things that is missing is a systematic way of collecting user views on it.
And what about the independent assessor idea?
I think there's potentially some value in that. I think the thing that I'm thinking of is the work capability assessment. There was the Harrington review, which is an independent review that went through 3 iterations, and there's still are problems within the work capability assessment. I think that's fair to say. So I think the question on an independent assessor is the kind of leverage and the kind of bite that they would have to actually make changes in the programme.
Okay, Duncan.
I think you're going to need a variety of tools, some minimum standards and people being clear, but that shouldn't be the minimum you don't go above. But at the moment, 58% of homeless people have not had any assessment properly of their needs and understanding. So minimum standards, some distance travel tools, there are tools out there, and that not just are about progress that you've made, but also about the confidence the individual feels. Client feedback. Lots of organisations do it, it should be there, and it doesn't mean you mandate a single system, but you have a system which is verifiable and you report that to DWP and crucially to your clients and other organisations. Mark Hoban started talking about progression payments when you're in work, actually looking at that in the pre-work journey, particularly around if you're in work placements or volunteering. And I think there is the Merlin standard, which DWP will probably come and talk about and say it's really good. There was supposed to be a framework that should be used to look at the supply chain and see what's happening there. And ultimately, DWP probably need to do a bit more, not necessarily digging around. They need to just pick some areas and do some digging around and see what's actually happening on the ground. Open up that box, see the woodlice crawling under the stones, and see what's really happening in different areas. And they could even in some areas, if there was poor performance, take a contract. Effectively a supply chain in-house to try and get a better sense of what was going on, and because they really need to understand more what's happening. And then we also do need to look at the basic payment processes, because actually, given what the referrals, most of them have been on JSA, but yet have got very high levels of need, many of those are actually you can't do it all by payment by results, but what we've got by payment by results at the moment isn't fine-tuned enough to recognise what's going on, so you do need to look at that.
Yeah, we're coming on to that in just a minute.
Yeah, one final question, and that's about complaints. An awful lot of people say the system isn't working. Why the level of complaints, relatively speaking, so low? Formal complaints.
People don't know how to complain. In fact, they're not told how to complain, and a lot of the single parents that I interviewed would then, when they went to their signing on at Job Centre Plus, they'd go, I'm not happy about this, what do they do? And they go, no, you're on the work programme and you're nothing to do with it. So I think there's a low understanding of how to complain.
So you're saying that most people don't know that the independent case examiner exists?
No.
I think a lot of people with mental health problems don't have the confidence to complain, so I think that's a big issue. I think people underestimate the impact of a mental health problem in that respect, and some people actually drop out of the benefit system, which probably is sadly chalked up as a as a success, and when actually it's that the person just can't interact with it anymore. I think another point, and I think this is a very sad point, but when people are getting very poor service, for instance they've been parked, some people with mental health problems are so grateful to be left alone by a system which so far, because of the WCA and that initial interaction which says, you now will need to do the things that we say because otherwise you'll be sanctioned. They're so grateful that they've not heard anything further, that the last thing they're going to do is raise their heads above the parapet. And I think that's very unfortunate, because it means that we aren't actually finding out the full implications.
So what can we do differently? What is the magic bullet which is going to enable people to understand and make sensible use of that complaint process?
Well, I've said this before. I think that the initial bad well, I think the WCA, if you could take the bad experience out of the WCA, that would be helpful. But if your initial interaction with the work programme was a much more positive one, then it would be something that people would have expectations of and want to be involved in, and then they would feel motivated to complain when they weren't getting what they felt they'd been promised.
I think that as well, does speak a little bit to the issue of minimum standards again. I think you could think about minimum standards in two ways. Should it be something that is, in effect, comes from DWP and that all providers have to meet? Or is it just a case of all providers being expected to provide their own minimum offer that they can be held accountable for delivering? And so, as I'm sure the committee knows, each provider has done that, but in some cases they're actually quite general, they're not very specific, so it might be you will have regular contact with a member of staff which doesn't specify who or how often, for instance. So as a bare minimum, it might be getting providers to work up their own minimum standards to something that's a bit more robust and a bit clearer, that people can say, well, yeah, hang on, I'm not receiving this.
Yeah, I think that moves us into the next section.
Yes, indeed it does. On to payment groups, which I think we've already covered, but I'll leave Glenda to ask bits.
Yeah.
Well, it's your question, Glenda.
Yes, I know, but this relates to the previous exchange. And I personally found it deeply, deeply unacceptable that Mr. Burley implied that a single parent refusing to accept a trained teacher, not wanting to be a dinner lady, because she preferred to be on benefits. Could I just point out that single parents work extremely hard because they actually have to be two parents, and that is work. And perhaps we should be examining the old requirement many, many years ago of keeping women at work but paying them a vast amount of money because of all the jobs that they actually do at home. Okay, now I'll come on to I just want that on the record.
I think our witnesses were very clear in explaining that too.
Thank you. This is for Sophie. You've said that the payment groups within the work programme are too broad. So presumably you would like to see claimants classified differently. How would you do that, and how many payment groups do you think would arise if that happened?
I think this is a really difficult question, and it's because we've created a system which depends on a financial incentive, which potentially is the problem. But if we're going to start off with a system that is based on a financial incentive, which I don't know that would be the way that I would go, but if that is where you're going, then
what
it
you
needs
mean
to be
payment by results would not be your chosen path in this way? Because that's what it essentially is, isn't it?
Yes.
Yeah.
I think it's very difficult. Once you're going to give anything to a provider who's going to be motivated by the income, obviously you're going to have to find a system which is incentivising them in some way, and the result is what the system wants out of it. So you're sort of stuck with that. But it would be good to look a lot more at what the other mechanisms might be and what the other drivers might be along Anne-Marie Morris's question about how you then mitigate some of the implications of that. I can't answer, I haven't really thought about how many groups you would have, but I think what you'd want to have is an assessment process that looked at a range of different issues and then categorised on a range of different issues, rather than just at the moment on somebody's functional assessment of their disability, because that doesn't take into account confidence levels, which obviously doesn't take into account skills and experience at working, and it doesn't take into account the difficulties that people face externally in terms of employer attitudes. Now, how you'd put all that into a system, I don't know. That would be a challenge for bigger economic heads than mine.
If I could just say very briefly...
Absolutely, you can all chip in.
I'm aware that this was raised by some of the experts at the previous session. It would be, I think might be some value in the department looking at or potentially trialling an approach similar to the Australian JSCI, Job Seeker Classification Instrument model, which, as the committee may know, has been developed over a number of years and refined over that period, and is now... I'm not going to claim that it's perfect or that in its own way it can't, it's not without its own problems, but it's probably a more reliable indicator of needs, barriers, and the amount of support needed to overcome them than this very, very crude, broad payment by benefit types that we have at the moment.
Glenda, would you mind? I just want to...
Yeah, sure.
And I hope people are watching this don't think people on this side of the room aren't interested in the subject, because it's just the way the questions have fallen that we got the second half and we're now running out of time. If you had a test like that, who would do it?
Exactly.
Now, it's I think relevant to all of these sort of questions. Would it be done by? Is this something Job Centre should do, or should the work programme provider do it? And if it then defines what money you get, should it be a work programme provider who does it?
Ideally, this is where you would have a warm handover. It was a three-way between the work programme provider, the job centre and the individual themselves. Because at the moment, I talked about, there are higher payment groups, the early entrance groups, where you would get extra £3,000 if Job Centre Plus identified them properly, but they're not currently. There's obviously a challenge that you don't want it entirely with the work programme provider, because they might start finding barriers to work that were great to chalk up. So there does need to be some, which is going to involve time and effort. But if you've got a calibrated system with a range of individual payments reflecting barriers and needs, that ideally would be done on the basis that Job Centre Plus understand it and are clear, work programme provider understands it and is clear, and then the support they're referred to is the best support. The big fundamental challenge at the moment is we've said it should be a system based on need, but then built it around benefit types, and actually the benefit type that you were on doesn't necessarily reflect your need particularly, because we've got the WCA process as well. So you could potentially got the WCA process, which lands you not only into a category which is putting conditions around you to move into work, but then you might actually be able to make it into work, but you're not then entitled to the support that would allow you to do that, because you're put into the JSA group rather than the ESA group. So that you can't take away from this WCA work programme interaction as a real problem for any system that relies on payment by benefit type.
But can I just say, I don't think Mind anyway would want to see one assessment that covers both the benefit and the need, because the level of anxiety that relates to the WCA process, because and will always do, even with a fantastic system, because it relates to somebody's income, isn't a good basis for a good discussion about needs.
They still need to be separate.
They still need to be separate.
Yeah, we agree with that as well.
Yeah.
But that leads very neatly on to the next question here, because if the work programme does move away from classifying claimants according to benefit type, which you've already said is the wrong way round, isn't it going to become excessively, from an administration point of view, complex? I mean, could that not have a knock-on deleterious effect on the claimant, because they would actually slip further and further down the system? I mean, we're seeing at the moment, aren't we, the concentration is on JSA, and the hardest to reach are effectively being parked up. So if this changed, could there be the knock-on effect of leaving your client groups further down the chain?
I think there's two things. I think firstly there's the issue of how we assess distance from work, how we assess employability, which comes under the kind of work capability assessment thing. I think that's one issue. And the second thing is a kind of gateway mechanism into the work programme, which is I think what Duncan is talking about, where you have the individual concerned, you have the provider, you have the Job Centre Plus advisor, all working collaboratively to decide whether someone goes into the thing. The question of complexity and whether that is making it too many categories, too difficult to administer, I think I would strongly argue that it wouldn't, and the reason I would argue that is because person-centred planning has become the gold standard across a range of different public service types. Things like social care, for instance, would be the best example. And that hasn't added to the complexity, rather it's streamlined it for the user. So rather than kind of starting from the perspective of the kind of bureaucracy, you start from the perspective of kind of what's the user's experience, what do they want to go through the programme, and by making it built around the individual, you achieve all sorts of positive knock-on effects, but you reduce the complexity for them. So I think it's interesting. I think there's those two separate issues.
But where's that support going to come from? I mean, you're talking about a perfect system of people who absolutely understand, which we were led to believe by the government was going to be inherent in this programme, but it clearly isn't. I mean, you mentioned work capability assessment. I mean, the complaints we all receive as constituency MPs on that are growing exponentially. So where would you look for that kind of support to come?
Well, in many cases, those specialist organisations are already on work programme supply chains, but not being used.
So it's the linkage, is it? I mean, is it already out there, but nobody's actually tapping into it?
I think it's the linkage, and if the route that we are going to go down is really around tinkering with the incentives to align them, then maybe we also need to look at some of that payment being reallocated and coming at different points. So, for example, if what's needed is, and I'm thinking specifically about people with histories of drug use here, is some form of sort of very specific assessment followed by some psychosocial intervention, which is then handed back over to a mainstream provider. Well, actually, that's something that should probably come reasonably early in the process, and there could be an argument made that money to pay for that should be accessed earlier rather than being contingent upon an outcome. So I think in terms of, is a specialist support there? Well, it's certainly out there, and in many cases is nominally, if not in reality, on work programme supply chains. So I think again, it's about if the incentives are going to be the levers, then see, can they be pushed left and right as well as forwards and backwards, if that makes sense.
And where should the responsibility for that referral lie?
Well, obviously within the current system, it lies with. In the current system, I guess it relies with the prime contractor. We may be going back to this idea about how is quality monitored, because one of the things that would be of interest in terms of assessing the quality of the work programme is are those options to refer people to specialist services, are they being exercised?
Well, we were told they were. That's how they got their contracts. I'm sorry, Sophie, you wanted to jump in.
I was just going to say, in the best circumstances, this is what happens anyway. People get a good assessment, and then they get support and advice and guidance and interventions appropriate to that assessment, and in the best circumstances then that can support somebody to get sustainable work. So making a system that did that routinely would actually not be an administrative burden. It would smooth things out fundamentally for everybody. I do think that the Job Centre Plus has a role to play, and whether there needs to be whether everybody should be going into the work programme, or whether more people should be going to work choice, or whether there should be other things available at that level, I think is worth looking at.
Thank you.
Could I just, I wonder if I could ask, as a follow-up really to something that Graham asked earlier, and I was wanting to ask it then, for anybody here, and just those who may have had experience initially as subcontractors, I think Graham's challenge was, are you feeding your expertise into the system? My question would be, if you have been or are contractors, have you ever been asked to feed that into the process by the prime contractor that you're working with?
I was going to say one of the things that we've had most referrals on from some of our local mines have contacted us have been when either the job centre or the contractor has contacted them because they've had people who they feel shouldn't be involved in work-related activities at all and should be in the support group, and they've had them referred back to them to support them with an appeal. So actually some of the contact that we've had has not been the contact we expected to have, which has been very interesting.
Agencies from the substance sector have, certainly as an umbrella organisation, our input's been sought by providers. Providers have been asked to go in and provide treatment to work programme providers, provide training to work programme providers, that kind of thing. So it is going on. It's maybe just not having the impact at the scale that we'd like to see it.
But can voluntary organisations be expected? I mean, prime contractors, seems to me, pitched for this work on the basis that they could provide all this. I'm uncertain why you should be being asked to provide all this expertise, apparently for free.
I mean, in some instances, voluntary organisations are subsidising the work programme because they are doing things, continuing to run training, employment, supported employment opportunities, work placements, and more in-depth help around housing or other issues, but they're not getting paid for it out of the work programme supply chain. But we do it because we're charities and we want to ensure that those needs are met. I think one of the challenges about what's happening is, Graham, you asked, are we feeding back to the work programme? The problem is the work programme isn't our thing. It's in every area. It's a range of different bodies and your issues might be at a whole range of different points. And actually people aren't necessarily clear themselves as a subcontractor why I'm not getting referrals. Is it because of Job Centre Plus not putting the referrals on, or is it because of the Prime, or all the rest of it? And there's a whole series of conversations you've got to have, which takes time. We're focusing, as Crisis, on the Job Centre end, and we're trying to provide training and expertise about better identification there. Other people are being able to make their supply chain work, but it all takes time and effort to follow up supply chain or individual complaints or client experiences.
When WCA was first introduced, there was a second stage to it, which was the work-focused health-related assessment, which was done at the same time, which may be problematic, perhaps, as Sophie said earlier. But does anybody think something like that? I mean, that was dropped. It was in the system initially. It was dropped by the government a couple of years back and has not been reinstated. And the aim of that was effectively, it seems to me, about how somebody's condition could be managed, how they could be sort of helped into work, which seems to be closer to some of these distance to work conversations you're having.
I mean, I'd have to look into the kind of evaluations of how that works. I mean, I don't know the detail, unfortunately, of the...
I don't think it ran for very
module.
long as part of the problem, because, of course, WC only came in 2008, 9, and then it was dropped in 2010. So.
I mean, I'd strongly support I'd strongly support anything that brought into the work capability assessment more measures of employability, more measures of the barriers that disabled people face, rather than focusing on the medical capability. But I think it's important just to focus on the kind of the big question around the WCA, which is the fact that it's placing onto the work programme disabled people on employment support allowance who are a long way from work, who need a great deal of support and who are not being supported through the work programme. You know, we know the figures overall for the work programme, which is kind of 1 in 3 are disabled people, but only 1 in 5 of the job outcomes are from that group. But for the ESA group, those statistics are far worse. It's something like 1.3% of claimants who come onto the work programme from the employment and support allowance have got a job outcome. For those who come off incapacity benefit and then onto ESA, the figures are even worse. We're looking at 0.3%, and Scope's statistical analysis says that's only around 30 people from that group who are getting jobs through the work programme. The work programme is not supporting this particular group into work. that problem is compounded when you look at the overall picture of the employment support landscape. We've spoken a lot about work choice today. Work choice is a pretty successful scheme in comparison to the work programme. 24-25% outcome rate there. But again, only 16-17% of people on work choice are from the ESA claiming group. There's this group of people who are not being supported on the work programme, who aren't being supported on work choice, and are kind of falling through the gaps in those programmes. And I would draw that back to the kind of issue around the work capability assessment.
But I think maybe Sophie was suggesting that if you test people for their eligibility for benefit and you mix that up with the other assessment, were you suggesting they probably shouldn't be done at the same time, or because the purpose is different?
Yes, I would separate them out. I mean, that it may well be appropriate to consider how difficult it is for someone to get a job in terms of deciding what their benefit is. But I think a conversation which is about someone's income should be separate from a conversation about what support you get. So whatever goes into the conversation about what benefit you receive, when you start to have a conversation about how will Job Centre Plus help you, or what can we put into place to support you, or what do you need to do and what do you want from us to help you do that, all of that sort of conversation needs to happen in a much more positive and less anxiety inducing environment, I think.
And I think certainly for JSCI it's very much not something I think that could realistically form part of the WCA in that it's looking at different things, and it's as much as anything a predictive tool. So I think it would be entirely appropriate to have.
When the government suspended the work focus health related assessment, or the WFRA as it gone, they said it was because they were introducing the work programme, and the initial interview that a referee got with either the prime or the subcontractor would be the equivalent. Now, from what you're saying and from the evidence we've got, that doesn't seem to be happening. Is that right?
Yes, it is from our experience, and some of the prime contractors have been kind enough to share their diagnostic tools with me. And what we've seen is that so the questions might be quite very specific and detailed with regards to things. So issues around transport, travel, physical health. But then start to get the questions start to get a bit vague when it comes to anything that might be considered a more socially difficult subject to raise. So for things like accommodation, drug use, alcohol use, mental health, the questions start to get a little bit vague and a little bit euphemistic in some cases. So certainly there's certainly scope that if people don't volunteer that information, or if they're not able to read between the lines of the questions that are being asked, that information won't be picked up by the work programme provider at that point.
I think as well what Paul said there underlines that it's an assessment rather than a discussion, and I think how Duncan was describing it earlier, where you have a conversation with the individual with Job Centre Plus and with the work provider who might be providing that support, a conversation about, what are your aspirations, how might we get you there, what we have is this, and what's in the work environment at the moment is that. That's not a list of questions and writing down some things on a form. That's a conversation about, that's the beginning of the process, and I think that's a qualitatively different approach.
I just wondered in those situations, would it be helpful if the individual claimant had someone with them who, if they dried up for a minute, could act as their voice? And could we make, do you think that would be valuable and useful? It wouldn't cover everybody, because of course there are people who have no one that they could take.
It would be really valuable for mental health, and they might not even speak up for the person, but having them
just someone there
is a confidence inducing in itself. Yeah.
I think going back to that thing about assessment, the things we need to be clear about with the work programme, much of what's happening is based around a model of a kind of generic job seeker. So some of those questions as well about travel, those are barriers, but there are also barriers that people think, well, if I give them some money to help cover travel, that will cover that, and it will help them prepare a CV. And much of it is what was previously happening in Job Centre Plus or on New Deal or other programmes. And it's not to say it isn't important, and it doesn't help people to help them think about travel and budgeting and can you get a suit and how do we improve your CV. But what the work programme was supposed to be was more than that. And that's why us as a set of client groups are here because we're generally representing people who needed more than that to tackle those issues around debt and housing and mental health and physical health and self-confidence and all the rest of it. And we're never seeming to get to the point where that is being unlocked in the supply chain, where actually we're saying, right, we'll provide this range of in-depth tailored support that we'd really need to help these people get into work. What's happening is a lot of there are exceptions, but fairly standard conversations. And we had a client who was sent off on a literacy course to improve his English because he was from an African background and actually his English was perfect, but that was sort of the computer says you go off and do a literacy course. And we've had people hauled off programs that they've been doing and training and this has happened on the previous programs as well, that were good for them because they've been told, well, you'll go off and do basic Word or whatever, even if you're actually quite good at computers. What we need is a tailored approach, and what we're getting too often is standardised assessment and standardised offers.
I was just going to go into specialist. Right. Teresa hasn't asked anything, so I'm going to ask her, and then I'm going into Nigel and specialist expertise.
I'm just going to make a point of what was said earlier about the amount of time you spend with Job Centre Plus and personalising. I was on Job Seekers Allowance when I took a voluntary redundancy, and I didn't really need it. I just wanted my stamp paid, so I had to claim. I remember saying to the person there, actually, I think maybe instead of looking for a job, I'll go on a course. And she tried to refer me to Resources Plus, which is a place that does numeracy and literacy courses. I'd just left a 6-figure salary job. I clearly didn't need that. But the point is, she didn't look at me as a person or even look at my CV. And if she was giving me that wrong advice, which I could reject, what sort of wrong advice was being given to other people? And it's exactly that. The people come through need to be customers, not commodities. And it seems to me that the work programme policy is good, but they're delivering a contract rather than a policy. And if the policy fails, it will be because of the contract, not because of what everybody wants, which is for people to have sustainable work.
I think the work programme has kind of delivered through payment by results a step change in policy and a step change in process, but it doesn't seem to necessarily deliver a step change in outcomes yet. And I think I'm sceptical. Some people have mentioned previously and in the previous panels about kind of using prices to drive improvements in the system, and I think it's worth raising some scepticism about that. I think just to give you an example, one young man, sort of mid-20s, one of Scope's customers, in his mid-20s, has learning difficulties, mobility impairments and epilepsy, had been on 17 different employment support programs and hasn't yet found a job. He's incredibly motivated, he sees the value of work, he wants to get into work, and he's an ex-IB claimant, so he actually attracts the highest placement fee for the programme, and he hasn't yet been found a job. And I think there's some scepticism about simply making him of greater monetary value to a provider is necessarily going to deliver him the right kind of support, the right quality of support, and get him the kind of job placement that he's looking for. I think that's an issue with raising.
I think there probably needs to be a balanced approach, looking at the range of levers that are still available, the ones that haven't been surrendered as part of the black box process. And so I think clearly the direction of travel is that the price incentivisation is a part of that, but I wouldn't have thought it's to any degree, to any extent, a complete solution.
Absolutely.
Okay, and Nigel, and finally the last section.
I think we've covered a lot of the specialist expertise area, and that people you're trying to support need specialised support. Do you see the prime contractors getting slowly better in this area, that they're kind of learning how to deal with people, or do you see it just still being as bad as it was at the start?
I think there is some improvement in some areas, so that's around the type and the frequency of communication that goes on. So I think, as I said earlier, there are some encouraging signs around that. I think the problem where it comes in for the work programme, where it is now, is that if one looks at the performance against expectations, and I don't want to go too far into that, other than to point out that. At the level of performance that it's currently at, I would assume that the income flows will be below where they're expected to be, which could create further difficulties in accessing specialist support. And is there in a sense a financial imperative to retrench somewhat and concentrate on the core business of getting the easiest help back to work, and actually the more expensive business of supporting those with additional barriers gets put to one side. So yes, there are some small encouraging signs in localised places, but I'm still very concerned about the future.
But you're not seeing, say, ex-contractor in X city where they've had a big incidence of mental health issues have become quite good at supporting those people. You're not seeing that kind of specialisms being built up by certain contractors in certain areas. That's just not.
I think that there are within some prime contractors, probably less so in others.
In terms of the single parents I interviewed, only there wasn't much evidence of people being transferred onto other services, so it was always very sort of internally focused. The one person who did move into employment had a lone parent advisor on the work programme, so they had a sort of system that when people referred to the programme, that's who they would see, and it was really effective. And that's been all the evidence for the DWP research is that lone parent advisors within Job Centre Plus were really effective, and I wasn't overall seeing much specialism at all, and that's a real issue, and that doesn't seem to be changing. And it's it is more expensive having that specialism, but it helps. It definitely helped that person move into work because they were seen sort of in the round, seen very much that they also needed to care for their child, and negotiating with an employer, and all sorts of things that help someone move into work. And they were very good as well about supporting that person once they were in work and giving ongoing support.
So we're in a situation where we probably need more specialist subcontracting or spot contracting, but there's less money around for the contractors given they've not hit their targets. I mean, is the only fix for that the government should mandate some subcontracting and say you must subcontract people in these categories somewhere?
Or it takes...
Or internally. I mean, this was a lone parent advisor within the provider. It wasn't a moved-on service.
I think part of the problem with mandating something would be it's not always easy to identify people that need that sort of service, because we've spoken about the way that need isn't always identified at Job Centre Plus, and similarly isn't always picked up at the work programme stage. So
you couldn't mandate it.
It would make it very difficult.
I think when it comes to mental health as well, very large numbers of people within the system, including people on JSA, have mental health problems of some sort that might not be the primary reason why they're not in work, but it has become an issue for them. And so to have a very sort of fixed system, which is if you're a single parent you go here, if you're homeless you go there, doesn't actually take into account the complexity of people's lives. So there does need to be external expertise, but that will be no substitute for having quite a good understanding of level expertise actually within the prime.
And if I give it's only a sort of small example within that, but lots of single parents, before they're moving into work, will get a better off in work calculation, which they used to be able to get at Job Centre Plus. And that's very important for someone moving off benefits and into work. And there isn't that expertise within the work programme, and yet people on the work programme, those single parents will go, well, who can give me that calculation? And say, well, we don't have that expertise, and yet they can't go back to the job centre and see someone there because they're on the work programme. Things like that might just seem sort of slightly more mundane, but they're actually very important. And I think from some of the examples I had, it actually was stopping people moving into work.
There's probably three sets of things they could do. One is about better transparency, ensuring the existing contracts work. Secondly is about actually exercising. DWP's got the right to terminate some contracts, and there might be a stage where it actually says, okay, we need to terminate a prime contractor's contract, either to re-let it when there's better specifications around disadvantaged groups and use of subcontracts, and that when they appear on a bid they're in the supply chain and there's clarity over referrals, etc. And the third approach is to say, actually, maybe the work programme to work for everyone who's out of work we need some more differentiation and more programmes like Work Choice, but for some other groups where there's some more direct contracting of specialist providers outside of the arrangement through the prime. And that might be better value for money and might deliver at least a better certainty of who's going to be worked with and what they get, and understanding what the outcomes reached are.
Because I mean, that's going to be hard, isn't it? Because if I'm a prime contractor and I'm doing really well with people who's been out of work a long time, so my stats are pretty good, I've met my contract requirements, but I'm terrible at the harder to reach because I've prioritised on the ones that are easier. How you measure that they're missing their contract requirements, so you could take the contract away, it would be quite hard then, wouldn't it? You'd be really getting quite granular in the actual detail of who's being helped by what contractor, wouldn't you?
But maybe that's where a much better assessment conversation with the Job Centre Plus, and much better understanding of who you're passing on to the provider and what their needs are would be very helpful, because then that granularity would be available, because you would know, because you'd have the assessments, you'd know who the provider was prioritising and who they were putting aside, and maybe then that's the Job Centre Plus to make better decisions about saying, well, okay, well maybe that's good, maybe that's, you have a system where you say maybe that's fine, you're very good at that, well just carry on being good at that if that's what you're good at, and these other people will give to somebody who's good at that. And there's no reason why we should assume that a one-size-fits-all system would work. Well, we know it doesn't, in fact.
What you're saying that the financial incentives have not really been there for the prime contractors to subcontract unless it's an end-to-end, but for very small bits of the customer journey, that's not been financially viable, and that's why you've been providing that service free. But you give it, Laurie, you give an example of a loan parent advisor working for the prime. So within the way the contract is, there's nothing presumably to stop the primes actually directly employing people with that expertise.
No.
And them doing the triaging of their own client group.
Yeah, well, and that's the example that
that's
I had.
the example you
yeah.
give.
There wasn't a lot of evidence.
Does that get over a lot of the problems that we've been talking about lack of financing and lack of specialist help, if the primes perhaps themselves started to look, rather than Nigel says, looking at the low-hanging fruit or the easy ones, but actually looking at all the others.
Well, ultimately, we should stand up for the client group primarily. If they're going to be getting helped by a prime contractor who's put in place themselves in-house the range of support, then that's a good thing. You know, because that then individual who is getting help back to work. The challenge is that that's not what
that's not what's happening at the.
So if they wanted to do that, if they took the view that we want control over our staffing, our referral numbers, our much closer view on what we deliver, we have it in house. Fine, but that isn't the experience that's happening.
And some of that expertise as well, the primes and what worked, was around things like people with an HR specialism within a prime contractor of the work programme, which was very effective for some single parents, that they knew what agencies to refer them to, that they help them write their CV in a better way, a competence-based CV rather than a chronological one, because they're not going to have such a long career history. So, I mean, yes, I agree. I think that prime contractors can have that expertise.
There's questions for us to put to the prime contractors. Thank you very much for coming along this morning. It's been quite a long morning. It's always difficult when there's five witnesses and everybody has got their own views quite rightly, but it's always difficult to fit everything in. But can I thank you all for coming along this morning, and your evidence will be very useful for us when we come to compose our report. So thank you very much. Order.